Here with a very special guest, colleague and friend, Dr. Vincent Felitti, co-principal investigator of the ACE study. And in the last segment, you could answer 4 questions of the 10, yes or no. And we're going to get to what helps people or what can people do once they do have an ACE score. You do want to know your own ACE score. You want to know the people in your family. You want to know the people you work with. People are asking now in schools, police departments, legislatures. So there's been a big change. I remember when we were first collaborating together, it was hard to get people to accept the ACE. And now it seems like it's global and many different institutions. We just saw a few days ago, Delaware is now accepting it. What's happened politically with the ACE study? Now it's in the schools, now it's in states.
The biggest political change has been the interest in state legislatures because of the 35% reduction in doctor office visits having huge, literally multi-billion-dollar implications for state Medicaid budgets and so forth. And there are now 21 different state legislatures that have passed legislation designed to support the routine collection of this information in medical practice. Now, whether that will work out is yet to be determined, but the intensity of interest is certainly clear at this point.
One of the questions we will also get to with Dr. Felitti is sort of the fork in the road. When somebody has an ACE score of 2, 3, 4, 5, 6, how do some people end up in death row? How do some people end up managing to have a better life? Who works on it? Who doesn't? What work they do on themselves? What work they don't do? Let me throw in, because I want to make sure all the questions get asked so you can find out what your score is. You've already heard 4 questions, so you have a score of 0 to 4. Did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? Or your parents were too drunk or too high to take care of you and to take you to the doctor if needed? Yes or no? Was a biological parent ever lost to you through divorce, abandonment, or another reason? Yes or no? Was your mother or stepmother often or very often pushed, grabbed, slapped, or something thrown at her? Or something sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard? The thing about the ACE scores is you were answering yes or no. We also have learned that if we're in a family where somebody's being hit or abused or sexually abused, even if you're not the one, it impacts you in very similar ways because emotions are so contagious that you could have an ACE score of 6 because your family member had a 6, and that's how much it impacted you. But we're going to get to more of the ACE questions. And back to Dr. Felitti, that you mentioned something important about the treatment and what people can do at that fork in the road where they know they've been traumatized, they know they've been abused, and they feel it's bringing them down. They've got to hide it, control it, repress it. It just isn't working. They're drinking, smoking, doing drugs. And then there's another group that seems to find some strength from other people. What's that? How does that happen? What's that fork in the road look like? Where's the hope there for people?
Well, perhaps a key issue to pay attention to is what's termed traumatic stress. The effect of these life experiences in childhood hyperstimulating certain areas of the brain, altering normal body functions. You mentioned immune system, yes, suppression of the immune system and the huge implications that has, another causing the release of inflammatory chemicals and the major effect that has, particularly on blood vessel problems and heart disease, etc. Then obviously the emotional effects like depression, suicidality, chronic anxiety, and so on. So those are the common ways that this plays out. A more subtle way that it plays out is through so-called epigenetic effects. Epigenetics is a relatively new field. The word will be unknown to most people. It refers to the impact of social influences on gene function, not on gene structure. That would be a mutation. On gene function, essentially like putting an on-off switch on a gene, but it's leaving its structure intact. And that is a field we did not study. The word barely existed when we put the ACE study together. It has grown explosively since then, and you'll be hearing a lot about that, epigenetic effects. And those are transmissible through generations.
Wow. So the ACE experiences, the ACE score, the trauma people go through happens to the individual, the family there, and even future generations.
Yes.
And we even know with things like sexual abuse and physical abuse that oftentimes people that have been abused pass it on because they haven't worked it out. They've never resolved it. They've never done any work. So they unconsciously, subconsciously just continue to just perpetuate that. And it can go on. I mean, I remember a case that we worked with. I had 5 generations in the room and sexual abuse amongst all 5. And it just was going. Fortunately, we stopped the pattern. That's 5 generations.
Yeah.
Tremendous amount of negative impact on more than those 5 people.
Yes.
Right. So the hope, the what people can do about it, the number one thing is that people have to deal with their ACE scores. Repressing, controlling, hiding, secrets don't work. And how we work on those, well, I've devoted my career to helping people deal with their ACE experiences, partnering with Dr. Felitti, who's been able to assess and diagnose not only what your score is, but the impact in so many different realms. Now, just before we get to the last segment, which will give you the most hope, which is the future of the ACE study, I want to ask you the last 3 questions. And I'm going to go to, did you live with anyone who was a problem drinker or alcoholic or used street drugs? Yes or no? Was a household member depressed or mentally ill, or did a household member attempt suicide? Did a household member go to prison? So now you've heard all 10 questions. Now you know you have a score of 0 to 10. You can learn a lot more about the ACE study, and we'll have some resources for you. The last segment is going to be about the future. Where is all of this going? Not just locally, not just in the US, but globally. Not just politically, financially, families, personally. So I'll see you at the last segment.